basic thing in research methodology, which is how to generate a research question and make you understand about research hypothesis. Now, this is the first step of starting your research, and it makes your process clear about what you're dealing with. So, a research question is something you want to know about your discipline or about a specific area within your discipline. So, orthopedic is your discipline. You might want to research something in, a knee joint problem. It's not a topic, fragment, phrase, or a sentence. It ends with a question mark. So, it's a very specific thing, and it has to be clear and precisely stated once it is formulated. It is not to be broad and nor it is to be very narrow. It needs to be a bit open-ended as opposed to a closed-ended one. It cannot be answered in a sentence or a phrase. So at the end of a research, if the answer is a yes or a no or a black and a white, so I don't think that research was actually required. So I have a research question when I join as a postgraduate, so I'm very lucky. There is invariably a scenario that I don't have a research question. So what do? You try to understand what is the area of specialization which is being done in the particular unit you're working, and then you try to look at problems which are there in that particular region. So if your unit is managing more of knee problems, something must be on discussion in the unit regarding knee problems. So then you go and look at the literature and see whether that problem is solved in literature, or even literature is not very clear on that part of the question. And if there is actually a gap in the knowledge in the literature, it helps you understand that this seems to be a relevant or a question which might excite some interest, so that you have an answer at the end of your research work. So then you have to look whether your research is actually viable. You might be thinking of a topic in robotic needs, and you don't have a robot in your unit. And is it actually original, feasible, and the economics related, the time, the human resource available. So if once you look into all these things related to your area of interest, you actually end up with formulating your research question. So let's take this example. So this is about media violence. It's a very broad topic. It's about media violence, and you could correlate it that maybe it is due to the teens watching a lot of violent video games. And then you browse a few books or ideas and see which age group is probably into it, and you understand that probably the teenagers. And then you again narrow it further. And is there any evidence that violent video games increase violence in teens? So it becomes a very very specific target to look at, starting from a very broad base. So in my outpatient, there's a very, very common thing department. I noticed a rather unusual number of women under the age of 45 with advanced OA of the knee. They look physiologically older, many are overweight, and they all have varus alignment with few exceptions. So I asked myself, is there a possible cause-effect relationship in the incidence of OA in such young patients? So together, you're trying to gradually come down to a problem. So what are your resources? You check your OPD statistics, you check with your colleagues. We see about 10 patients of this type in a span of about 6 months. So in about 1 year, you might have 20 patients. At least half get advised TK and not all undergo TK. So these are rough statistics which you gather from your colleagues. They might not be very accurate. You might have to go into the medical records and then find out, so that you start getting an idea whether you had an adequate sample to investigate. So I have a postgraduate coming in a month, so that is almost actually true. Maybe by August 10, we start getting postgraduates this year. It's a short research project listing no more than 2 years. So cannot do long-term longitudinal studies. You need a narrower problem. For example, if you decide that, okay, we'll start following all 40-year-old ladies for the next 10 years, so that cannot become a thesis topic because it needs to be completed in a year and a half. So you do a literature search and you read about this problem and you define the problem, going a little back. We start, once you look at literature, literature is talking about the tibiofemoral plane alignment, the coronal plane alignment of the knee, the CPAK alignment, which is coming in a big way after robotics. In patients presenting with mechanical knee pain, population presenting to our hospital. So, is there a constitutional virus that predisposes to early knee pain and early degenerative arthritis? Or, the other things you are looking at could be a secondary question: are they overweight? What is the BMI and the incidence of diabetes in the population? So, about the hypothesis, there is no abnormality in the frontal plane tibiofemoral alignment. The patients presenting with mechanical knee pain and early OA in a population of patients in South. Now, there is no correlation between BMI and early osteoarthritic pain in the study population. So the difference between a research question and a hypothesis is, a research question is, you can say it is a end with a question mark and you don't know the answer to it. And you do the research and find the answer. And what about hypothesis? It is actually a statement. And it is actually a predictive statement, or it is a probability statement, or it is your experience, or whatever you're guessing. So here I've stated two things. One is the tibiofemoral alignment, and other, which was a secondary question, the BMI and diabetes in these patients. So hypotheses are actually tested in a research project, and they are either proven or disproved. So the projects which include questions which already have an answer lying in the literature, you actually try to revisit them, and you take the existing literature knowledge as the hypothesis and try to prove it or disprove. And for questions that don't have an answer, probably research question comes first. So the research question is actually looking at the why and the what, and maybe at times when and how also. So what is the problem I want to study? What is the domain? Here, as we are discussing, it is a knee, the domain, the subject, probably degenerative knee, and the population, we are trying to look at women over 40 who are obese and having comorbidities. So why do I want to study research this problem? Literature review has suggested that probably at this age, this problem still is not very well researched, and there is a gap of knowledge in the literature search. And on doing a feasibility test, there is an adequate sample size coming to the OPD now units. And there is some amount of lacuna in understanding. Even the senior faculty in the unit doesn't have a straight answer that why do we have such type of females coming in our OPD. So there's a curiosity to understand a newer dimension to the issue, and that is how this research question becomes interesting, and it appears to be a feasible one. So isolating and defining a scientific problem is the crux of the whole research question. There has to be interest attached to it, increase in knowledge expected from the study. And if it's a very easy answer, it doesn't come into a research problem. And if it's a very complex one, you might not find an answer at all. So ranked by the amount in which they increase verifiable knowledge, the research question should have some amount of interest attached to it. The feasibility is a very, very important thing which all the postgraduate students have to very extensively look at, given their guides, whether the problem is hard or easy to solve. The units of time to completion, this is very critical, dependent on the skills of the researcher and the resources available for the study. And what looks easy on paper is often hard to execute, and what's hard on paper can turn out virtually impossible. A very small thing that you say, okay, we'll include BMI, and you will be struggling to get the weight and height of every patient. Once you start doing the study, you will realize you've missed quite a few patients. They had to be excluded because you did not have the BMI. So feasibility is connected to the human resource and the time available. also the infrastructure, and interest is a very important thing. Unless it is a significant contribution to the knowledge and the interest is not generated, you will not be able to focus on the research. So, looking at the human resource feasibility, the level of capability from an undergraduate to a full-time researcher would be different. Nowadays, you have the STH program during MBBS where you do small projects. So, the level of capability of an undergraduate and a postgraduate and a PhD student will be different. And you'll have to factor in this point when defining your research question. So, why do you need a research question philosophically? Once you have it, a very discrete and a clear research question, it gives you a direction of how to work, keeps you on a focus, and you have a tangible objective. You're actually trying to solve an unsolved, literature issue, and it keeps you motivated. And there's a sense of purpose when you have a very clear research question. So, if I have to tell you what are the attributes of a good research question, it needs to be very clear. It should be it needs to be very easily understood. It should be very objectively worded. It should be focused, narrow enough to be answered thoroughly, and it should be concise, expressed in few words. The complexity, it has to be balanced. If it is a question that can be answered in a yes or a no, it's not a great question. But it should not be so complex that you have to, follow up your DPN patient for the next 10 years and look into their genetic profile and then answer a question. And then at the end of such problems which deserve a research, it should be open to debate. So an important part of discussion when you write down your research is what was the lacuna which came up when you started and you completed your research, and that actually guides further research and further exploring the same problem. So the process of finding a journal question, choose an interesting journal topic. The preliminary search has to be in the literature with your peers and your colleagues, your juniors and your seniors in the unit. Start asking questions to yourself. Look at the questions in the literature, discuss it with your unit. Evaluate your question. First you actually derive a question, and then you frame a question and make it more discrete using very clear variables which could be dependent on different variables. And then formulate a hypothesis if it is coming out of the research question. So the hypotheses are generated from the research question and can be the other way around. So for a good research to be done, it is very important to spend time on developing a research protocol, which Dr. Pal will take up in the lecture. And to develop a good protocol, the first building block is actually the research question. So spend time on it. It should not be that you start doing this 1 week before the last day of submission. You should spend at least around 4 to 6 weeks in developing a protocol. And I think half the time of that will be spent on generating a research question and hypothesis. So there would be primary and secondary questions which should be coming up in your research, as I had mentioned in the example. And there are a few mnemonics which are attached to a research question, like FINER is one of them. I've already talked about this, we'll just repeat it. IF is for feasibility, adequate number of subjects, adequate technical expertise, adequate infrastructure, affordable both in time and money, and manageable in scope. So this is a very, very important thing to do before we get on with the research. Interesting. Getting the answer is of interest to investigator, peers, and community. So that drives everybody in the unit to do a good research. There should be some amount of novelty attached to it. It refutes or extends on previous findings or brings in something new. And definitely it should be ethics should be very clear. The patient privacy, there should be no harm extended to the patient, and it should be relevant to scientific knowledge, clinical and or public health and future research. So these are the mnemonics for good question. And recently another R has been attached, and it should be reproducible. It was told earlier that the research methodology should be reproducible. So if you do a good research question, that also should be. And then there is another mnemonic by the name of PCOL. Now, PCOT and final both can become a part of your research question. And when you publish uh, your research, it can become a title also. And when you make your synopsis or your protocol, again, the title is connected to the research question through these mnemonics. So P is population of interest of the patient population, in our case, females over 40. Intervention, exposure or treatment or interest. In our case, probably we're just observing certain alignments and comorbidities. Control is normally the standard of care and comparative population. An outcome of interest, and then a time is attached to it. How much time, what time you want to give, what sort of a follow-up you want. So to wind off, I think the research question should drive the research design, and the question should actually come up from a practical problem that you're facing in your clinical practice. You should not be imagining doing research on scoliosis when you're working in a unit which does knee or hip work. So it should help solve a problem, which is a practical problem related to the patients, which motivates to create a good research question, and that research question will actually define the research problem and help you create a correct research design to solve the problem. So once you solve it, there's a research answer, and that ultimately helps you to solve a practical problem. So these are the various steps in doing it. And once again, I thank all of you on behalf of Indian Journal of Orthopedics on taking up this excellent initiative on educating the next generation. Thank you very much.